In my review of medical aid in dying, a couple of questions about medications have come to me that I'd like to address because perhaps I wasn't fully clear. The patient must be able to be of sound mind and clarity to have made the decision and to follow through and take their own medications. I've had a couple of patients who really couldn't swallow safely because of their disease, like cancer of the throat. So they actually had an NG tube, that's a nasogastric tube placed. It goes in the nose and down into the stomach. In that case, the patient really had to use a syringe to push the medication through the tube and into the stomach. So this is an example, again, of the patient having to ingest their own medications. The medications that are given an hour before are really powerful antiemetics. Those are medications that prevent nausea. It's so the patient won't be nauseated and they won't throw up the MAID medications once they're taken. And you might ask, well, what happens if they do throw up the medications? Well, if it was most of the medications and then they get drowsy, they would most likely go to sleep for many hours, but they would not die. And in one case, Brenda had a patient, a woman who vomited the medications right back into the glass that they had been in. She looked at Brenda and she just drank them down again. See, these are people who are fully and irrevocably ready and wanting to die in their own choice. There's one more question that came up about whether the patient could still be receiving comfort medications prior to the MAID meds. That might be morphine, oxycodone, lorazepam, or Haldol, things for their symptom management needs. And it's certainly fine to continue to provide those comfort medications right up to the ingestion of the medical aid in dying medications, as long as the patient is fully alert and able to take those medications unassisted. I hope that clears up a couple of questions, and thanks so much for listening. Get our booklet at the Hospice Care Plan or watch more videos on our YouTube site. Remember our motto, care is treatment.